Our next blitz is very interesting because this is Ainhoa Gomez-Lumbreras and looking at long COVID. And she told me at the break that this conference sort of inspired this study. So this is kind of cool. All right, you're on.
Well, yeah. Thank you so much for having me. And I must say that, yeah, because of this symposium, we decided to analyze it taking into a gender perspective instead the way we were going to do it as a whole. I'm presenting this research that I was carrying with my mentor here, Dr. Talk. I'm a postdoctoral fellow at the pharmacotherapy department here at the College of Pharmacy. So as I only have 4 minutes, I'm going to go as fast as I can. You know, I'm not an English native speaker, but I will try to do my best. I think we all know that sex has been one of the determinant factor for the severe and also the fatal outcomes, being the male sex more affected by the acute infections of COVID-19. However, among those surviving, women have shown to have a higher prevalence of long COVID. Long COVID defined as those symptoms that persist, that arise again and have kind of a relapse, and even new comorbidities that are appearing in these long COVID affected people. So we also wanted to get a perspective into the gender, as we think it's key to understand the experience of health. So that's why we initially conducted a cross-sectional study using an online survey that was distributed among social media, long COVID supporting groups in Facebook and Reddit. We asked participants to report sociodemographic information, quality of life, symptoms, health comorbidities, and also healthcare resource utilization. And among all the questions that we made, we also asked about the gender. They could select woman, man, non-binary, transgender, and also prefer not to answer or other. And we ended up to having 74 responded to the gender question. 9% did not answer that question. 44 were women and 30 men. So for the sociodemographic variables, we just found differences in the age. Women affected by long COVID were 7 years older than men in average. And also, even if we found that COVID-19 tests were more done in men as well as the antibodies, we did not find statistical differences. But we did find the differences in who had made the long COVID diagnosis. And it has been more times made of a physician in women, 77% compared to men. Regarding the symptoms, we asked them to report the severity of those symptoms, but we did not find any differences. It is true that 3 women reported to be in severe symptoms, but we did find differences in the length of the long COVID, that it was 14 months for women compared to 11 months in men. We also asked them a bunch of comorbidities to be selected pre-COVID and post-COVID. On average, women had more pre-COVID and post-COVID comorbidities, but what did impact us most is like the increase on these comorbidities. That was 1.5 comorbidities on average in women compared to half of those, 0.7 in men. We did not find any differences regarding the primary care, ER, or hospitalization visits related to COVID. And even if not statistical significant, apparently women get more prescribed medications to treat long COVID and its symptoms. We also asked them about the quality of life and the disability. We see that in the 5-dimension scale, that is why it's brighter. We did not find any statistical differences, but we did find it for the disability. The World Health Organization Disability Assessment Scale had a higher score in women, that is the green, and it was about the average 53, seeing like moderate disability compared to 43 in men, that it was a mild disability. In the patient-reported outcomes measure information system, in the subscale of the mental health, we did not find differences, but we did find in the physical health, where men that are the bright yellow score higher on average, meaning that they reported a higher physical health. To wrap everything up as soon as I can, well, we might say that there are differences among women and men. Women tend to experience more severe, more longer, and also more disability in long COVID. This data kind of suggests we have the limitation of the small sample size, only 74 respondents, but may indicate that there are differences in symptomatologies between men and women. And also that we are still trying to recruit more respondents to see if we can find any more differences. And thanks for the ones that have stopped in by the poster. I have also some other ideas to keep on answering. Thank you so much.